New research released today shows some popular weight loss medications may also help reduce the risk of some brain-related disorders like dementia and Alzheimer's disease. Two new studies suggest the class of diabetes drugs that includes Ozempic and Wegovy have the added benefit of protecting against developing dementia. Now, the connection between type 2 diabetes and dementia has long been known, but now more research will have to be done to determine the impacts of these drugs on lowering a person's risk. CBS News medical contributor Dr. Céline Gounder joins us now. She's also editor-at-large for public health at KFF Health News. Doctor, thanks for being here. What do we know here about this possible link that these drugs could help protect people from these disorders?
There are two different studies that were published today. One was an analysis of 26 separate clinical trials looking at medications for diabetes, including some of these newer medications like Ozempic and Mounjaro. These were not studies that were specifically designed to look at dementia, however. So I think that's important to understand. Okay. What we saw from those is that they demonstrate a hint that these medications may protect against dementia. The second study was analyzing people's medical records. And medical records are also not the same as the kinds of records analysis you do when somebody is in a clinical trial. But they looked at tens of thousands of medical records, and they found that at least with some of these newer medications for diabetes, for weight loss, there again seemed to be a protective effect. And so this leads us to be cautiously optimistic that perhaps these medications could help prevent or treat Alzheimer's and other forms of dementia.
But much more needs to be known before we can say that there is, in fact, causal link.
That's right. Much more needs to be done. We have, for example, evidence in mice that there might be some benefit to medications like Mounjaro for diseases like Alzheimer's. We have clinical trials that are in progress to specifically look at medications like Ozempic for dementia. But until we do that, one of these studies, for example, we saw that healthier, younger people were more likely to be on these medications. So is it that you were simply seeing a lower risk of dementia because these were younger, healthier people? Or was it actually the drug? So these kinds of details really do matter here.
Okay, so a little bit more to figure out there. I wanted to ask you about something that sort of made news at the end of last week that we didn't quite get to. The Trump administration deciding against this proposal that Medicare and Medicaid would cover these drugs for weight loss. What is the significance there? What should we know?
Yeah, this is really important because this is going to determine whether people have access to these medications or not. So late in the Biden administration, they proposed a rule that Medicare would broaden coverage for anybody with obesity to these medications. Right now, you need to have diabetes or some other medical issue in addition to obesity. The Trump administration has walked that back, said we're not going to do that. And so right now, even if we had data that showed these medications are helpful in preventing or treating dementia, that does not mean your insurance company is going to cover it. And it is very expensive to cover all these medications. Congressional Budget Office has looked at this. We're looking at an additional $35 billion over 10 years if this were to be made available to anybody on Medicare who had obesity.
And we still don't know whether somebody who has obesity and these other health factors could actually save insurance companies more money in the long run from those debilitating diseases. We don't have that.
We don't have that data yet. And that's, again, another important reason we need to be doing these clinical trials. No one's going to want to spend money on these medications for dementia if they don't even prevent dementia, if they don't even prevent some of these other medical conditions that would save the companies money.
Okay. All right, Dr. Céline Gounder, thank you so much.